Hello and welcome to Weston Park Cancer Centre Radiotherapy Department. This is where your radiotherapy treatment will be planned and given. In this video, we're going to cover what will happen during the planning and treatment process and hopefully answer any questions you may have. When you arrive in the department, give your name to the receptionist and take a seat. One of the therapeutic radiographers will come and meet you and explain what will be happening. To plan your radiotherapy treatment, a CT scan will be needed. The doctor uses the images from the scan to mark the area to be treated, and an individual treatment plan will be created. The radiographer will take you into the scanner room and will help you into the position you need to be in for the treatment. We will need to do the planning scan with all your clothes removed from the waist up. We can provide you with a gown for you to wear. It is important to tell the radiographers if you are not comfortable prior to the scan, as they may be able to change your position slightly. Once in the correct position, a radiographer will draw with a felt tip pen around your breast. This involves feeling for your bones and the breast tissue. These marks will be able to be washed off afterwards. You'll be taken further into the CT scanner, but you must lie still and breathe normally. The radiographers will leave the room and complete the CT scan from the control area. They can see and hear you at all times and can come back into the room and temporarily stop the process if required. You'll move in and out of the scanner several times while all the necessary images are collected. When you are having treatment to your left side, the deep inspiration breath hold technique can be used to help ensure that the radiation avoids certain organs such as the heart. This involves holding and controlling your breath during the planning scan and treatment. To help you with this, a screen is placed in front of your face which shows you a picture representation of your breathing, indicating how deep you need to breathe and for how long you need to hold your breath. A small box will also be rested onto your chest during the scan and each treatment. You will receive a booklet with written advice on preparing for the scan prior to the appointment, and the radiographers will practice this with you before the CT scan to make sure you are comfortable before going ahead. Once the scan is complete, we will, with your consent, place permanent tattoo marks onto the chest area. Typically, there are 3 of these, often placed one in the centre of your chest and one on either side. They are permanent and the size of a small freckle. These cannot be washed off. They are used every time you attend for your radiotherapy treatment to ensure that you are in the same position as when you had your CT scan. All you feel is a sharp scratch when these are being done. Any pen marks left can be washed off. You will be given a list of all your appointments, and the radiographers will advise if you are able to leave the department. Radiotherapy treatment will start around 1 to 2 weeks after this appointment. You will have a separate consent appointment to see the doctor or a member of their team. This appointment is to explain radiotherapy treatment in more detail and to go through possible treatment side effects. A consent form will need to be signed if you're happy to go ahead with the treatment, and any questions can be answered at this point, so it may be beneficial to write these down before attending. This may have been done at an outside clinic. There may be a review once a week during your radiotherapy treatment with the doctor or a member of their team to assess how you are and if you are experiencing any treatment side effects. They will be able to offer advice and help you deal with any discomfort. This appointment will show as review on your appointment list. At your first treatment appointment, a radiographer will meet you to explain what will happen in the treatment room, discuss again any possible side effects, and answer any questions you may have. You will need to be in the same position as you were for the CT scan, and the radiographers will help guide you into this position. The room lights will be dimmed, and the radiographers will move you and the machine into the correct position. You are asked to keep still and breathe normally. If you are being treated using the DIBH breathing technique, the screen will be placed in front of your face, which helps you control your breathing. You are asked to keep still and breathe as planned. Once you and the machine are in the correct position, the radiographers will leave the room. Cameras are always operating in the treatment room, so if you require assistance, please raise a hand and the team will come straight in. The treatment machine will move around you and the bed may also move slightly. This is all controlled by the radiographers. You will hear the noise of the machine, but it will not touch you. You will not see or feel anything during the treatment. This is all controlled by the radiographers. They will talk to you on an intercom, indicating when you need to breathe in and hold your breath. The treatment will only start when you are ready and your breathing is as it was when the treatment was planned. You'll be in the treatment position for approximately 15 to 20 minutes, but the treatment time itself is only around 2 minutes. You will receive the same treatment dose each time you attend. After the treatment, you can leave the radiotherapy department. If you have any questions, please contact us. We're here to help you every step of the way.